everybody in this room, you're here for a reason. You know about the chronic disease explosion that's happening. What does this mean? This means there are people with serious diseases who are out and about in their community most of the time. Yes, they need the care of a skilled physician, but most of the time they're going about their daily lives. So Medopad is part of the solution, just one part of the solution for this. We have two parts. So one is the patient view, which they will see on their mobile app, either iOS or Android. They will gather their data as they go about their daily lives, what the clinician decides is relevant for them, and give consent for the care team to view it. The care team can log on through a web portal and see the data that's submitted by their patients and make decisions on their care based around this. Now, the user interface has been developed in a partnership with Apple. We're a global mobility partner with them, but it is available in iOS and Android as well. Now, why is Medopad different? Well, ours is a modular solution, which means it can be configured for lots of different disease areas. So we have a menu of modules. Just to give you a couple of examples, this is one that we did for splanchnic venous thrombosis at the Royal Free, one of the biggest teaching hospitals in London. Another selection of modules, and this was a configuration for DIPG, a very rare form of pediatric cancer. This means that we can be a single provider of remote patient monitoring solutions for an organization. One set of due diligence, one set of contracting, et cetera, which is extremely valuable for hospitals and healthcare providers. As I mentioned, we have a wide variety of modules available, either data that patients gather themselves, quantitative or qualitative, from wearables, self-assessments, educational modules. And this allows us to cover a wide range of diseases, as I said earlier. Our core business started off in the NHS. We're a London-based company, as John mentioned, working in rare and high-cost chronic diseases. We've started to spread geographically, but also working now with pharma and medtech companies into population health. We recently won a contract with Singapore to look at monitoring of metabolic disorders. And this has led to some inquiries on things which we would never have imagined. We got approached by the Lawn Tennis Association and by Chelsea Football Club to ask if we could monitor the health of their elite athletes. So we're experimenting in a few things around that. Aspects of health you might not think of. Now, so far, our success has been built on the content that's been developed by Medopad and by Apple, but we really want to be a platform for bringing the best-in-class digital health solutions to patients. And we've built the partnerships around this, so this can include people who have very specialist specialist tools for that patients can use to track their progress, analytics, things like SAP HANA. So if you like what you hear, thank you very much, and please get in touch.